I'm Dr. Michael Khouri. I am a cardiologist here at Duke Health. I am by training a heart failure doctor, and I take care of patients, two groups of patients specifically. So I take care of patients who are cancer patients who have cardiovascular disease, and I also take care of patients who have a disease called cardiac amyloidosis. Cardiac amyloidosis is a disease where an abnormal protein called amyloid can embed itself in the heart muscle. Those patients will oftentimes develop heart failure. They'll oftentimes develop arrhythmic disease such as atrial fibrillation, and oftentimes require a pacemaker. Some of those patients will also have other non-cardiac manifestations such as musculoskeletal diseases that can sometimes be early markers for amyloidosis as a systemic disease. A little bit about the patients, cancer patients who have cardiovascular disease. So many of these patients who get newly diagnosed with cancer will either have pre-existing cardiovascular disease that we help manage alongside the oncologists who are treating them with chemotherapy. We'll also have patients who are being treated with chemotherapy where some of the complications of this chemotherapy can affect the heart. And we are there to help identify those potential complications as well as treat them and help shepherd the patient through chemotherapy and cancer treatment in general. And then finally, there are also cancer patients who have successfully treated their cancer, who, as they age, may develop cardiovascular disease, and treatment for that cardiovascular disease may require some degree of incorporation of their prior cancer treatment. And so I also am accustomed to treating those patients, and we take care of a lot of them as well. We understand what those patients go through. We also understand what their oncologists are trying to do to help treat them, and we also understand where our being able to identify and treat cardiovascular disease in the midst of their cancer treatment, we have a good understanding of how to help the patient shepherd them through cancer treatment without interrupting or stopping cancer treatment, which is the ultimate goal.